Good afternoon, everyone, and welcome to the College Orientation Summer Webinar Series. My name is Whitney Hedge. I'm the Associate Director for Orientation, and I'll be serving as your moderator today. Today's webinar is about student wellness, all of the services and opportunities available to you as a UChicago student or available to your student as a family member. The majority of the webinar today will be a presentation from our colleagues over in Student Wellness, and we'll leave time at the end to answer Q&A. Please feel free to submit your questions via the Q&A box located at the bottom of your screens. We will do our best to get through as many questions that are submitted either through the chat or answer live at the end. I'm going to pass it over to Elizabeth Webb, Director of Health Promotion for UChicago Student Wellness.
Thanks, Whitney. All right, everyone, give me one moment while I just share my slides here. Okay, great. Well, thank you so much, everyone, for being here. We really appreciate it. We are here this afternoon to provide just a brief overview of UChicago Student Wellness. As Whitney mentioned, my name is Elizabeth Webb. I am the Director of Health Promotion. With me today is Karina Bauer, our Associate Director of Clinical Services, Celia Bergman, our program manager, who focuses on our university student health insurance plan and immunization requirements, among other things, and Andrea Magano, who's our quality management nurse supervisor. So you'll be hearing from all of us today. And we just appreciate you being here, and hopefully we'll have time at the end for questions, but please feel free to submit them as you have them. So at the University of Chicago, students have access to coordinated and comprehensive medical, mental health, and health promotion services that are really targeted at building and maintaining students' overall well-being. So we're going to talk about each of these services today and dig into how you can access them, what we offer, etc. So we really are here to support you or your student throughout your entire time at UChicago. When you're feeling well, with preventive care and wellness programs, but also when you're feeling not so great, feeling overwhelmed, or just need some additional support. But we really are here for you throughout your entire time at UChicago. So we really encourage you to take advantage of our services while you're here. The Student Wellness Center is located at 840 East 59th Street, where that blue star is on the map, if you can see it. If for those of you who haven't been to campus or aren't as familiar, this might not mean a whole lot to you now, but hopefully it will soon. We are open Monday through Friday from 8 a.m. to 5 p.m. And we're generally open during school breaks as well. So we're open over the summer, we're open over winter break, but we do have some closures for holidays. So it's just important to check our calendar for any closures. To access medical, mental health, or health promotion services, you can always call us at our number listed on the screen at 773-834-9355. And actually, if you take a moment to scan the QR code, it will download our contact information in your phone. So it's a great, easy way to get all of our contact information into your phone. Just give you a second to do that. And we can send these later too, or come back to this if anyone needs us to. So we also offer access, all students have access to the wellness portal. And some of you may have already logged into this, but this is where you make appointments, you can ask questions, you can contact your provider. This is where you need to upload your immunization records. You can also see test results in here. And all students can access this portal by scanning the QR code on this screen as well. And then just inputting your CNET ID, your password, and your date of birth. And then once you're logged in, you can actually personalize your account. You can put your preferred name if it's different than what's listed in your account. You can put your pronouns, etc. So you can make it yours so that we know how to address you. And I'm going to pass it over to Andrea to talk a little bit more about our medical services.
All right. Well, hello and welcome, everyone. My name is Andrea Magana. I'm a quality management nurse supervisor here in the Wellness Center. And at the Wellness Center, we have a full-fledged primary care clinic where we treat acute and chronic conditions. This means that we can help you with long-term care, such as physicals, chronic illness management, sexual health care, and more, or treat acute conditions such as respiratory infections like the cold and flu, injuries, STIs. Although we don't have an opportunity or we don't have the capability to treat emergencies here, some students do walk in with more emergent issues, and we do care for them. We are an appointment-based clinic, and we require all students to have an appointment to be seen by a provider. We don't offer walk-ins, although sometimes if you walk in, you will get an appointment only like if there's a cancellation. You can book appointments through the portal, like Elizabeth said, or we can do that over the phone. If you do intend to use the Student Wellness Center for medical services, we do recommend you establishing care by scheduling an annual wellness exam. And this way we can get a history, find out a little bit more about you and what your medical needs are, or potential issues that come up during the year. We also provide medical advice during business hours. So if you're not sure if you need an appointment or not, you can always call, ask to speak to a nurse or message a nurse, and then we'll get back to you and answer any questions. But rest assured, if you walk in, we will always help to make you an appointment or answer your questions to the best of our ability. So we offer a variety of medical services here, from routine physicals to travel health consultations, from sexual health appointments such as gyne exams, pregnancy testing, STI testing. We do offer allergy injections here after you've been established with an allergist, and rapid testing for COVID, strep, and flu. And under state of Illinois University and the university policy, students must submit proof of immunizations for a variety of diseases upon enrolling at the university. Generally, all new students need to submit proof of immunity from diseases listed on this slide. But some programs do have additional requirements, so make sure you check with your program. You may begin submitting your immunization records through the portal on August 1st. August 1st is the go live date or whatever you call it. And the deadline to do so is October 24th, 2025. And please note that records must be in English. We do not provide translation, and the translator or the translation must be certified. Students who do not submit proof by the deadline will be restricted from future quarters of registration here at the university. You may scan the QR code on the screen to learn more about the immunizations.
Thanks, Andrea. I'm
Yeah,
gonna
you're
pass
welcome.
it over to Karina to talk about mental health services.
Hello and welcome. Exciting kind of to be embarking on this next chapter and just wanting to share about our mental health services. So if you ever need any support in kind of promoting mental health well-being, we're here for you. Right in the slide is a picture of our staff. You'll see we have a pretty big staff. I think it's about 15 therapists, 2 case managers, 5 psychiatric staff, and we have a pretty big training team. We have a really incredibly wonderful and diverse staff of clinicians who speak multiple languages, including Spanish and Mandarin, and are really here to support and serve students in whatever concerns they're coming in with. So what or why do students come to see mental health services? We always really say no issue is too big or too small for us. If you're struggling at any point, we really welcome you to come in and get support from us. I'd say the biggest thing we see students for is a lot around anxiety, sometimes loneliness, academic stress, but really we have wonderful clinicians who are able to see you with whatever concerns you have. All of our services are completely confidential. Our services are free for students, and we really want you to come in if you need support. So I guess the first step is, how do you come see us? And if you want to access any of our mental health services, the first step is an initial consultation. The way you would schedule that is you can call us from 9 to 5, Monday through Friday, or 8 to 5, I should say. Our number's there, and a wellness coordinator who is wonderful and friendly will help connect you to a first appointment. Or you can go on to the portal that Elizabeth showed earlier. You can log into the wellness portal, look at all of our therapist profiles, and go ahead and schedule an appointment with the one you select at a time that works for you. These first appointments, like I said, are confidential and they're 30 minutes. They're virtual, and it's really just an opportunity to talk about kind of what your concerns are. The therapist will tend to ask you questions just to gather more information in that appointment, and then get you kind of connected to some support here or resources that best meet kind of your needs. I was just gonna say the other thing too, just to think about if you're incoming and you live in a dorm and you're like, oh my gosh, how am I gonna do a virtual appointment when I have this roommate? No, we also offer in-person. So if you wanted an in-person initial consultation, you could just call and the wellness coordinator will help you set that up. And then once you have that appointment, just know in that meeting with the therapist, you'll come up with a plan together. Here at Mental Health Services, we offer short-term individual therapy, couples therapy. When I say short-term, we don't have like a 4 sessions or certain limit. It really is a collaborative plan with the therapist you work with. We just want to make sure we get you connected and support you in the way that best serves you. We also offer psychiatric care. We have group therapy. We also have something called Academic Skills Assessment Program, ASAP, which is meeting with a therapist really focused on your academic concerns. If you're struggling with motivation or test anxiety, that's a great thing to reach out to and get some support around academic skills. All this information, please know, is updated on our website too, if you're kind of looking for specifics. We also have case management and referral support. We have 2 wonderful case managers who will help you if you're kind of like, oh, I'm looking for some more additional support and resources. How do I figure out what to do with my insurance? Or how much is this going to cost? Or where do I go? We have people who will really walk with you and are experts at the resources we have to just get you connected to the services kind of in the community if we can help with that. And then I will move on to timely care. So timely care is a really great service we offer. A lot of universities are also partnering with timely care to offer services for students. It's a telehealth service. It would be kind of, as it's noted here, something you would download on your phone. I would encourage you all to do that right now if you have your phones, just to get it on your phone so it's there. And it's this great service we pay for and work closely with timely care. And they offer for students virtual services like scheduled counseling sessions, Talk Now, psychiatry, health coaching, and a lot of other great services. I always like to plug them because they're 24/7. So if a student wants, kind of appointments Sunday afternoon or something, they're a great service. They're also available in all 50 states. So sometimes I tell students like, oh, like if you want to kind of utilize us during the academic year, but maybe you're going home to California in the fall, this could be a great service you use kind of while you're home for scheduled counseling. I'd say kind of just something to keep in mind. It does cover 12 free therapy sessions a year and it resets every fall. So it's kind of a nice supportive service we offer to students. The other piece to keep in mind is our psychiatric service. Like I said, we have 5 psychiatric staff members here. And the way you would want to access them is just like I said before, the initial consultation. Think of that as your way to get access to any of our mental health services. And it's really a way a therapist can help support you to connect you to the right places. So if you're a student coming in and you're like, wow, I really need to keep going on my medication that I'm on, you'd want to come in and as soon as possible, schedule that initial consultation with us. And in that meeting, the therapist will help connect you in the initial consultation to a psychiatric provider. The reason I say you want to do that as soon as possible is sometimes there is a wait to get connected with a psychiatric prescriber. So that's why we say kind of do it as soon as possible. And if you can, bring kind of a bridge prescription or some medication with you so you have a little bit of a buffer. I should also note that, like I said, you can always go online to schedule your initial consultation. We keep the appointments available up to 5 days. If we get booked out past 5 days, just call us. So if you log on and you're like, oh, I don't see an appointment, that means, which typically happens at the beginning of the year, we're a little busy, call and we'll get you connected. Any issues, you can always talk to someone like me, Karina, the clinical director, or other people on staff, and we'll support you if you're having a hard time getting in. And then additional services. This is something where, I would say if you can like us on some kind of social media or keep connected to our website, we'll update this. But we offer a lot of other support kind of, aside from kind of what I mentioned. We offer something called Let's Talk, which is a really great opportunity to come in and talk to a therapist. It's completely anonymous, it's drop-in, and we offer it in various locations on campus. And you could see that kind of on our website if you're looking for a spot. And it's really a space where you could just come in, talk to a therapist about whatever you want. There will be no kind of asking your name or anything like that. And it can sometimes just be something as needed or maybe a start to therapy if you're kind of just having questions about it. We also offer a lot of programs, support spaces, campus outreach. Like something I think we're bringing back this year is our therapy services, which I think is a huge hit. And then we also do a lot of psychotherapy groups throughout the year for students. And then something else to know about is our urgent mental health support. We are always available to students 24/7 if you need help in the moment. A great thing even to maybe write down is our on-call number that's listed here. And if you ever need to call a therapist, know we're available 24/7. You can just call that number and get help and support whatever you need. Similarly, below the Talk Now, that's through the Timely Care app. Talk Now is a great feature where you can kind of talk, get on a video, and just talk to a therapist in the moment if you're having any distress. Sometimes I see kind of the students may utilize that if like, oh, I didn't get my internship or I just went through a breakup. It's a great support service where you can just talk to a therapist in the moment if you just need some help. Also know we always have somebody here when we're open from 8:30 to 5, Monday through Friday. We have a wonderful counselor, Yael Hoffman, who is here just to see students who are walking in and is here if you just need support in the moment. We also have the other services like UCPD, 911, 988, those services too are here for you if needed.
Thanks, Karina. I'm going to talk a little bit about health promotion. So our health promotion staff really tries to understand the needs of students on campus and really just work to assist all students in achieving optimal health. So we offer wellness programs, resources, information, education, communication about all of our programs and services. And we really approach health and well-being from a holistic and inclusive standpoint that includes the 7 facets of well-being that are listed on this slide. So we really try to focus on each of these so that students can maintain balance within each of these areas just to be holistically well during their time here and hopefully beyond. So we focus on emotional, environmental, intellectual, spiritual, physical, financial, and social well-being and have programs that focus on each of those or sometimes multiples of those. And we also work directly with students to gain insight and feedback. We work with various student workers, but also just the general student body to make sure that we're always doing things in a way that is most helpful to students and meaningful to students to here at UChicago. All of us really are here for students. And so we just want to make sure that what we're doing is the best for the students that we have. This slide just shows a variety of different programs and initiatives that we focus on in health promotion. For example, we have mindfulness meditation courses and restorative yoga. We also have a variety of sleep programming. We have a training called Maroon Mental Health Matters, which really focuses on training staff, faculty, and students on recognizing signs and symptoms of mental health crises and how to help in the moment. We have a student recovery group that meets every week. We have a variety of things. We have safer sex supplies around campus. So we really try to promote health in all different ways. And then we also have student groups and advisory boards as well. So if these are things that you want to, that you're interested in or want to, belong to, like the advisory board, please feel free to reach out. I'm going to pass it over to Celia.
Okay, thanks, Elizabeth. So I get to talk about health insurance, everybody's favorite topic. So although student wellness generally does not utilize your insurance, the university does require that all students registered at the university have adequate health insurance. So for students who do not have adequate health insurance, the university administers a plan called the University Student Health Insurance Plan, which we refer to as USHIP. And of course, USHIP meets the university's requirement for health insurance. So adequate insurance. So how do we define that? We have a checklist called the comparable coverage requirements. And that checklist, there's a QR code here on the top. You can take a picture of that. And basically, we ask the student to please compare their current insurance with what's on this checklist. If you're not sure if your insurance meets all the requirements, you should talk to your current insurance plan administrator and share the checklist with them to see if it meets our requirements. And if so, then you can waive USHIP. But for students who don't have adequate health insurance, they can enroll in USHIP. And we will ask every student every year to confirm their insurance for the year. So either waiving USHIP or enrolling in USHIP. This coming fall, the deadline to enroll and or waive USHIP is October 17th. That's the third Friday of autumn quarter. And we have a lot of information about what USHIP covers, the waiver process, many other FAQs and other resources available on our website, which is just studentinsurance.uchicago.edu. And there's a QR code for that website as well. And then we invite you to stay connected with UChicago Student Wellness throughout your time at UChicago. And there's a variety of ways that you can do that. You can follow us on Instagram, subscribe to our events calendar. We also have a weekly wellness newsletter that you can subscribe to, as well as just generally checking out our website regularly for any updates. And you've got a bunch of QR codes there, which you are free to link to now to get signed up to these resources. And then, of course, even after this webinar, if you have any lingering questions or comments, compliments, concerns, you can submit those through this form, through this QR code on this slide. And of course, we know that urgent concerns can arise outside of the business hours for student wellness. So this slide also includes the ways that we can support you for your urgent medical and mental health concerns. Some of this was already touched upon. For urgent medical concerns outside of business hours, you can call the nurse advice line. That's 24/7. And the number is 866-243-1242. Or you can reach a student wellness on-call provider by calling 773-834-9355. And then for urgent mental health concerns outside of our business hours, you can contact the therapist on call, which Karina mentioned. That number is 773-702-3625. Or you can start a Timely Care Talk Now session by going to timelycare.com/UChicago. And then, of course, in an emergency situation, you can always call 911 or visit the UChicago Medicine Adult Emergency Room, which is located close to Student Wellness. It's located at 5656 South Maryland Avenue.
Thanks, Celia. So there are a few questions already popping up in the Q&A box. So the first one, someone was just asking, they said that they saw required immunizations are given on campus at no cost. Is this only for the listed immunizations required by the state of Illinois or other immunizations? A typical example is the hepatitis vaccine. So I don't know if Celia, Andrea, you want to answer that?
I can address the state of Illinois required immunizations. Those will be offered through student wellness, but we will need to actually see proof of your insurance starting this fall. So those you can get through us, you can schedule those appointments through us, but we do need proof of insurance for those particular vaccines. For the non-state of Illinois required, Andrea, you want to take that?
Yeah, so can you see me? No. Yes?
Yeah.
Maybe? Yeah. So for the non-required one, you will have to have a visit with one of the providers, and then you can discuss whether that's actually needed or not. What was it? Was it hepatitis B? What was the one? What was the vac?
It was,
Because Hep B, I think
to
is,
go. I think it was Hep B. I'm not,
all right,
answered. Hold on, sorry.
okay.
It was just hepatitis, it says.
Oh, hepatitis. Okay, so Hep B is actually, I believe it's a required vaccine, if I'm not mistaken.
It's
But
not part of the Illinois state requirements, but I don't know if, Andrea, if you're thinking of something else.
possibly, yeah, maybe for like medical students or something like
Okay,
that. But
okay.
it's required for them. It's also required for us. So,
The next question, Karina, is about scheduling a psychiatry appointment in the portal and just asking if students can do it now.
If you're a student, you'd want to wait till you get to Illinois. You know, for all mental health providers, you have to be in the state, the providers in. So a student would have to wait till they're in Illinois. And they can go ahead and once they're here, go ahead and schedule that initial consultation with one of our therapists who will refer them to one of our psychiatric prescribers. We have a few different options in terms of our psychiatric services. So it's always helpful to meet with our mental health therapist who can guide you to the right service. And I know sometimes it can be a little bit tricky with ADHD medication because I know you can't have like a 3-month supply. So know when a student comes in, if they're like, hey, I only have 2 weeks left of my medication or something like that, we're always willing to work with them and support them to kind of get them to psychiatric services as soon as we possibly can for them. But I'd say as soon as you get to Illinois and get settled, you want to make that appointment.
Thanks. Another question is for students with medical conditions, how can they transfer their medical records to UChicago?
yeah, so if you would like to see a provider here, all you would have to do is fill out a release of information, which is online, and submit that, and we would be able to share those records with your primary care provider back at home. If it's something that you want to continue care here, a lot of our providers will work with chronic conditions, and if we are unable to care for you here, we can also get you a referral to the medical center for care.
Thanks. And then Celia, I have another question about UChip.
Okay.
Well, there are a few actually, but if I'm getting to campus before fall quarter, can I still utilize UChip included health services? Actually, that's sort of a mixed question, I guess, but.
So if you're coming to campus before fall quarter, you can utilize student wellness as early as August 1st. And we encourage you to come in and visit us and say hi when you get to campus. With respect to USHIP, so again, that's the University Student Health Insurance Plan. So if you are going to be enrolling in USHIP, you will receive probably your first communication from us in early August to go ahead and take action to sign up. But the coverage doesn't actually begin until September 1st. So you wouldn't be able to use that USHIP coverage until September 1st, with the exception of students who need some sort of health insurance in August. You can sign up for what's called early arrival USHIP coverage. And for that particular coverage, you're just paying for the month of August initially, and you're paying directly to our student insurance carrier, which is United Healthcare Student Resources. The information about the early arrival coverage will be on our website. Again, that's studentinsurance.uchicago.edu. So if you need insurance for the month of August, that is an option. Otherwise, USHIP doesn't actually start until September 1st. But again, you don't have to have USHIP to access student wellness. Come into student wellness, we'll see you. We don't generally require insurance except for those state of Illinois immunizations. But yeah, so hopefully that answers your question.
And then as a non-US student, are there any prior requirements to register for USHIP?
No, there's no prior requirements. You just, when you sign up for USHIP, and again, you'll get an email in early August with the information about how to do that. The sign up will ask for your US address. So if you don't yet know your US address, you might want to hold off on signing up for UShip until you have that confirmed. Alternatively, this is just a suggestion, you can ask your academic department or somebody if you can use their address just as a placeholder until you can update your address. Because once you submit your address, you can make updates to it. So that's the only prior requirement, nothing else in particular for international students.
And then Celia, while I have you, the last question is, what is the cost of UShip?
So we are just getting ready to roll over our student insurance website with the 25-26 policy information because we're just now finishing the 24-25 policy year. It's a little over $5,000 a year. That's broken up into 3 quarterly installments. So you'll pay a third of that in August, or in autumn, a third of it in winter, a third of it in spring. Spring coverage automatically includes the summer months. But yeah, the total cost is just a little over $5,000.
And then there's a question here that says, do parents need a health proxy for the state of Illinois for the student in case of emergency? So Andrea, I don't know, or Celia maybe, but.
I'm not entirely sure. I'm not entirely sure for that question. I'm sorry.
That's okay.
You can research that and get back to you.
And I don't know if the question is regarding like a release of information or a
Healthcare power of attorney.
I was
power
thinking
of
I was thinking
attorney.
power of attorney, and I'm not sure, to be honest with you.
Okay.
Generally, we don't store healthcare power of attorney information. You know, you can definitely work that out with your student if you want to, you know, complete one of those, but generally that's not something that student wellness keeps in our records.
We do have, let me just add this to the chat about medical records and privacy.
Yeah.
If I can get this to work, I will in a second. I'll put it in there in a second. But there's another question, how do we request repeated prescriptions? I'm guessing that just means like
Refills?
refills, yeah.
Yeah. So if you're coming to campus, at least from if you're coming to the Wellness Center for any medical need, and you're seeing an outside provider for medications or anything, you can speak to one of our providers who will get some records and continue to prescribe those if it's kind of like a very stable chronic condition. If it's not such a stable chronic condition, we will refer you to a provider at UCM where you know, where you would get refills from, or you could get them from our providers as well if they're comfortable doing that.
Thanks. And I believe the last question that I can see anyway is just, so everything is free except for the immunizations. And I mean, Andrea, go ahead, but.
So so the care here is free and the immunizations are at no cost, but like Celia said, they do reach out to the insurance for those.
Yeah, and so all like mental health services are free. But if you were to get a prescription, for example, that's something that would be charged to your insurance. Medical services here are free. So if you come in for a gynecological exam, that's free. But sometimes if we have to send out testing outside of our walls, that will bill insurance. But everything that happens within our walls for the most part is free. And as Celia said, regardless of the type of insurance that you have. So sometimes people think they need to have the UChicago student insurance to access us, but that is not the case at all. And I'm seeing there's a question about a pharmacy close to campus. There's actually a pharmacy in the UChicago medicine building, like a block and a half away. There's also
There's
Walgreens.
Costco,
Yeah, there's a
Walgreens,
couple. So
CVS.
and oftentimes you can also get those delivered directly to your house. So I know for sure the UChicago Medicine Pharmacy will actually deliver as well. And then is psychiatry considered under student wellness and free?
We do have psychiatric prescribers here, so if the student works with them, that service is free. We don't lose insurance, except if they were to refill their prescription, they would pay for that. We also have psychiatric services through Timely Care, which is virtual and that's free. But for some, we also have some other options, like we work a lot with Meridian, which we have a collaboration under UShip. So sometimes that makes sense for a student to use that service. We also have some outside community psychiatric prescribers. We work with them. I prefer to where a student would use their insurance if there's some reason like they're under a time crunch or something else comes up that it makes the most sense for them. But in-house, it is a free service.
And then I see there's a question that Whitney added that was asked, I think, prior to the webinar today, and just it says, besides immunizations, do incoming students need a physical, a sports physical, any special paperwork needed from a doctor if they have type 1 diabetes?
No, it just no physical is required to come to campus. And as far as the diabetes goes, so if you're completely stable on you have a chronic condition and you're completely stable, you could see one of our providers who will continue to care for you here. If it's not so stable, we may refer you to like an endocrinologist at the medical center if you care to do that. Otherwise, you can keep seeing your provider back home, who knows you best. So it's totally up to you.
And then the last question I see now is a TB test mandatory? And then can it be administered at student wellness, or do they need to complete this before entering the US?
TB tests are not mandatory. They don't need to have one.
I know some schools require it, but we do
Yep.
not.
We don't.
Yeah.
Any last minute questions that anyone has? Oh, the closest hospital or ER. We're actually, so we are on the UChicago campus, but we are sort of nestled in the hospital campus to some extent. And so we are right next door to the University of Chicago Medicine, which also has an emergency department right next door. So we're very close. And often, actually, if someone does need emergency services, while we're open, we've had people like Andrea walk them right over to the ED. So we're definitely within walking distance. So oh, this is a question about the power of attorney. Whitney, maybe we can get back to you on that. Because we don't, and I think this is the correct answer, because we don't hold power of attorneys here, we don't have information about it on our website. Typically, if a student was in need of emergency assistance where they couldn't give consent to something, they wouldn't be within our facility. They would be in maybe the ED or somewhere else in another hospital. And so we typically wouldn't really be the ones that would need to utilize that or see that or offer that. So we don't have a lot of information on that, to be honest. But if someone has like a really specific question about that, you can always send us an email as well, or fill out that form, that question form that was on the slide that I think Celia showed earlier, to ask a question, and we can send that either to our medical director or our assistant vice president, who can maybe answer that a little bit better. Yeah, and I would say the same goes for that question. That's something that maybe we can answer offline a little bit more, just in terms of when we'll contact or inform parents for an emergency. I don't know, Karina, can you speak more to that from your end?
I know that there is a form parents and students can fill out before coming to, like, early, that gives parents permission if there is an emergency. I don't know if anybody else knows more about that. But I know that's something that's available for students to complete if the student and parent agree that that's something they want on file. And then for us, it, you know, wherever, in terms of mental health, if we're ever in a situation where a student comes in crisis and we need to take them to the hospital or things like that, we'll usually work with the student in the hospital around getting the parents informed and people on campus. But we hold the student's confidentiality as first.
Yeah.
Yeah, anyone over the age of 18 is considered an adult, and so the medical care that they receive here is confidential and private, and so we don't offer that to parents. But that's something, again, if there are more questions about that, please feel free to reach out.
Yeah, and typically we don't give medical information to parents without some sort of consent release signed that we can talk to the parent if they're over 18.
All right, looks like that's it.
Awesome. Well, we just want to say thank you again to our presenters from Student Wellness today and everyone who attended. Students, just a reminder, your 4th online orientation module was about all things student wellness. So be sure to get online and check that out. For families, the 4th family orientation newsletter covered student wellness. So again, you can find that in your inboxes or on the orientation website. Please visit our orientation website to learn more about our upcoming webinars and to see a link for this recording if you'd like to watch it back. Next week, we are hosting a few different webinars, the Introduction to College Advising and a few academic department webinars, so check those out. Other than that, I'll drop in the chat the link to check out the summer webinar series, but that's all we have. So thank you again to everyone and have a great rest of your day.
Thank you.